based on grassroots needs, wants, and encouragement.
Ma'am, you were critical of your opponent on the management of the healthcare system. What would you have done differently?
Well, I, for one, would have put together a plan to make sure that we weren't sending people abroad. David Freeman had a very good plan out of the military that dealt with emergency plans for pandemics that was ignored. When it comes to ICU beds, I've already said in this fourth wave that's coming, why have we not started preparing a temporary hospital? The Women's Pavilion is right now empty. Selkirk Hospital is empty. Even Dawson's third floor of their hospital is empty. We should have been getting a temporary hospital ready. We could use reservists. I sit on a reservist panel, an advisory panel. They have trained reservists that could help during COVID, and they never get asked for. So I would have asked for the reservists. I would have asked for the Army earlier. I would have asked for provinces to send us extra resources. I would have asked for graduating students in both the doctor's programs and nursing programs to come and help out. I can tell you, I had a nephew who was in his last week of nursing school, and just before they finished their practicals, they were shut down and not invited to take part in helping during COVID. He had to actually go to media, and I thank you for this, to try to get them active in this COVID fight. Thankfully, the government listened and allowed them to go and take part in helping with COVID. So I would have done things very differently. I'm worried right now that the fourth wave's coming, and we have not got a different plan than we had before. And I don't understand why we haven't decided to transfer low-level care patients to a temporary hospital where we can use regular nurses and we can use healthcare aides, etc. And then we will free up that bottleneck from ICUs to regular beds in our hospitals. I don't understand it, and I sure hope that we don't have the same situation happen once again where we have to send people away. I won't rip them away from their families in their time of need.